Hello, everyone. My name is Angelo Florimon. I'm currently a patient access representative at HCA.
Good evening, everyone. My name is Nicholas Velez. I currently work with the Miami VA for the Department of Veteran Affairs, and I am a management assistant for the medicine department.
Hello, everyone. My name is Sandy Moline. I am currently a business assistant at a dental office in Orlando, Florida.
Hey everyone, my name is Chase Summerhays. I work at Baptist Health in Jacksonville, so North Florida. I'm a medication history tech, working within the emergency departments across all 4 hospitals in Jacksonville.
Hi, and I'm Wayne Ramcharter. I'm a critical care and emergency medicine physician working in Orlando, Florida. Thank you for your time, and we're going to turn it over to Angelo.
So today, me and my group, we're going to be going over how can West Kendall Baptist Hospital lowers its costs and minimize the impact on reimbursement while continuing to provide care and excellent patient experience to its patients and to its community. Next slide, please. So healthcare costs has been escalating at an exponential rate for this last couple of decades. It's been approximated that over $3 trillion is being spent annually in the healthcare system. And unfortunately, this is causing funds to be deteriorated from families, payers, taxpayers, and businesses. And because of this, we get an influx of unemployed patients that are coming in to the emergency room and to any healthcare facility looking for care. It was approximated that on average, Americans spend between $456 monthly for care while spending $1,200 monthly for their family care. Next slide. Baptist Health, West Kendall Baptist Health has been South Florida as one of the leading South Florida hospitals in regards to its transparencies and when it comes to payments and patient elective procedures. But unfortunately, in 2015, external regulatory changes and the reimbursement model caused West Kendall to face a lot of financial challenges. And one of those regulatory changes focused on pay for service and the introduction of electronic healthcare records. At the same time, West Kendall saw a lot of different rates and the reimbursements for inpatient admissions between patient receiving coverages for Medicare, Medicaid, and hospitalization. Moreover, during that time, the observation patients and admission patients have been revealed that the recovery are being reviewed by recovery audits and increase in frequency and scrutiny. Although West Kendall could focus on private patient pay to maximize the reimbursement, that can cause a lot of decrease in the number of inpatient admissions and decrease in reimbursement per admission, and this can cause a lot of negative impact for its financial stability. Now I'm going to pass it down to Nico to talk about the landscapes of the hospital.
Thank you, Angelo. We've identified a few stakeholders for our problem statement. Of course, we have the West Kendall community. This is a community of approximately 300,000 people, and it is expected to grow exponentially about 6.6% to 375,000 people. Because of this rapid increase in the community, it is estimated that 25,000 residents were traveling to Miami for inpatient and emergency services. Due to the community being underserved, they campaigned to bring in more healthcare services west of the Turnpike. So they did bring urgent care centers, and eventually a deal was struck with the county to build a hospital, which is called the West Kendall Baptist Hospital. The West Kendall Baptist Hospital is part of the Baptist Health South Florida Network. This is a faith-based organization, part of the Tri-County area, which is the area where the network provides services. That's Miami-Dade, Broward, and Monroe counties. West Kendall is it was the newest hospital within the network, but since then they've added new additions to their network, such as the Miami Cardiac and Vascular Institute, as well as the Miami Neuroscience Institute. West Kendall is committed to providing the highest quality standards of care. They've given out millions in charitable care to families having difficulties paying for care. It was a $200 million project, which lasted about 10 years when it finally opened its doors on April 27th, 2011. It had a very successful first 3 years of operations, with many areas in the hospital recording record profits. It developed its outreach initiative of Healthy West Kendall, which has worked with community leaders, local and regional business leaders, governments, health departments, schools, police and fire departments, and other civic organizations to support healthy and wellness initiatives. If we go to the next slide, we have the staff of West Kendall Baptist Hospital. It included an executive team that was chosen within the network. Key players such as Heather Pierce, Kathy Campbell, and the CEO, Javier Hernandez, were handpicked to manage the success of the brand new hospital. Within a few months, they began hiring more leaders for all areas of the hospital, and thousands of new employees were hired by the Human Resources Department, and they range from nurses, technicians, clinical partners, medical professionals, and administrative personnel. The staff's consistent focus in patient safety and quality care earned them the best hospital experience by consumer reports, and they achieved a 100% national quality measures. We also have payers such as the Centers for Medicare and Medicaid Services and private insurance companies, as well as self-pay patients. CMS has placed emphasis in its most recent regulatory policies for reimbursement on pay-for-performance models for care. Among the most common of diagnosis-related bundle care payments and value-based purchasing programs that focus on the health outcomes for patients. This program simultaneously rewards care that is within the best practices and outcomes, supporting high quality and patient safety, and value is also assessed based on patient's experience, which impacts the overall reimbursement to the hospital. Patients, as we know, those that are insured, they don't pay for the entirety of the hospital bill. They are responsible for a deductible for the length of the stay of the admission or care. And they exert a considerable influence because of the level of satisfaction that they communicate about their care directly influences, like I said, the reimbursement to the hospital. And now I pass it on to Sandy for the options factor for our presentation.
Thank you so much, Nicholas. Okay, so moving forward in our presentation, myself as well as Chase and Wayne will discuss options and ideas that can help West Kendall Baptist Hospital lower its costs, minimize the impact on reimbursements while continuing to provide quality care and excellent patient experience. Okay, so one of our options is communication. Even though it may sound a little cliche, communication in any business can influence success. Especially in healthcare, communication is very important, or effective communication is very important between staff, departments, as well as patients. West Kendall Baptist Hospital already has a positive working dynamic, but there's always room for improvement, especially with these new implementations in the healthcare industry with these value-based programs. It is important that we provide quality care and to increase patient satisfaction. And to do so, it is wise for West Kendall Baptist Hospital to implement effective communication. These tasks can be done easily through clinical notes with the staff and sharing information with each department to make sure that there is minimal to no error, which could decrease the chances of adverse effects and possibly decrease patient satisfaction. One important factor for effective communication is the potential to decrease patient wait time, which also influences patient satisfaction. Another way is to communicate with our patient, keeping them in a know, knowing their diagnosis, their treatment, as well as follow-up care. And that can be easily done with communication between their provider as well as the patient, through notifications, through our database, through our system, so that it can be implemented that the patient is keeping track of their care as well as the physician as well. This strategy is a great implementation because it's minimum to no cost to the organization. And some strategies that can be implemented would be weekly meetings with the teams. It can be trainings as well. And then strong leadership can help affect the communication within the healthcare organization. Another option would be remaining competitive. So West Kendall has a history of merging with different healthcare organizations, just as Nicholas mentioned. Their cardiovascular center are great ways to help West Kendall Baptist Hospital remain competitive in the healthcare industry. So one way we discuss is, or one option we discuss is strategic partnership. So partnering with different hospitals, which will introduce West Kendall to potentially new patients, increasing their revenue, and also negotiating with these specialists or specialty physicians who can arrange visits into West Kendall Hospital to see these patients or see these residents, so that West Kendall can be exposed to new patients or new people in the community, increasing their revenue, increasing their patient satisfaction, decreasing the potential of negative impacts on their reimbursements. Going forward, we are going to pass it to Chase, who will discuss a next option.
Thank you, Sandy. So our next option is in regards to reducing workflow inefficiencies. So workflow inefficiencies can range from something as simple as having a printer in the wrong place, or something as complex as a poorly designed unit where supplies are not in convenient locations, workspaces are difficult to navigate around, it's difficult to move patients around, all things of that nature. How are we going to approach workplace inefficiencies? Our recommendation going with this particular option would be to introduce a Lean Six Sigma black belt team who would be able to, over an extended period of time, record, document, and notate any particular micro inefficiencies within a unit. These inefficiencies will not immediately reduce costs or make any high budget savings. However, a unit that has 30 individual staff members, even just being able to create a more efficient workspace that saves 2 minutes of time for each of those 30 individual staff members will save West Kendall Baptist Health about 365 hours of just wasted time. So creating a more efficient work environment will allow patients to come in, receive quality care that they are needing, and then be able to exit the unit, allowing turnover of bed space. Many of these inefficiencies can be addressed and fixed without any financial cost. Again, going back to that example of just moving something as simple as a printer or reorganizing storage areas. Some of these inefficiencies will have to be addressed by major construction or renovation of particular units, is why we recommend, if this option is chosen, to develop a team to address all those inefficiencies and show how to work those into any budget that West Kendall is proposing. With that, I'm going to go ahead and pass this off to Wayne.
Thanks, Chase. So kind of sticking along the lines of trying to see if we could try to reduce inefficiencies, and also kind of what Sandy was mentioning, we were thinking an approach that kind of takes some of those things and adds on it might be the way to go. So focus on enhanced communication. Let's see if we can, in addition to fostering a community that encourages and promotes communication between the healthcare team, let's also include trying to keep patients apprised of what's going on as well. The second part that often ends up limiting how patients end up progressing through the healthcare, through their hospitalization, often revolves around getting certain tests, either laboratory or imaging tests being done, or consultations with certain specialties to be done, and their input to help guide the patient's care through their hospitalization. Now, if that is kind of prioritized, that would probably end up enhancing how quickly decisions are being made, what decisions need to be made going forward to help navigate the patient through the hospitalization. And then if we kind of go back to that first point of trying to keep the patient up to date and keep the rest of the team up to date. So as these tests are being performed and as these consultation evaluations are being performed, and then we're keeping both the nurse apprised and the physician apprised, and then ultimately the patient apprised of what these results are, that should be able to help just with the experience for the patient as well as more efficiency for the healthcare team. The idea of using someone as a taskmaster, so this could be either possibly a charge nurse or a unit secretary, but ultimately the responsibility for this person is really to kind of keep apprised of what tests need to be performed on each patient, like kind of keeping a separate list for each patient of what needs to be done and what consultations or follow-ups need to be performed. And someone is kind of keeping up to date, are these tests being performed in a timely manner? And if, let's say, by halfway through the workday, so if the workday starts at like 7 in the morning, if by noon the test hasn't been performed or the consultation hasn't happened, then this taskmaster is reaching out to these people to say, hey, can we get a time frame on what needs to be happening? Now, from this, even as the taskmaster is reaching out, it does actually involve multi-department involvement. So often for these tests to be performed or happening outside of the patient care area, often it may end up being an imaging department like radiology or ultrasound, or it could be the lab that needs to be involved in it. And sometimes some of these tests that need to be performed, so in particular an imaging test or a radiographic, an imaging test or even certain laboratory tests, they may only be available for certain times out of the day. So if we think about the idea of reaching out to these departments to consider the idea of flexible scheduling, so as opposed to the usual kind of work time of the clinical time of 8 in the morning until 6 in the evening, if we end up asking for those flexible schedules to kind of be used so that we're looking at a time of availability that's more conducive to the patient and results will be delivered in a more timely fashion of, let's say, starting off at like 6 or 7 in the morning and that imaging test being available to be performed up until 12 o'clock midnight, then those results are actually available even sooner rather than that downtime of 6 o'clock in the evening, all again until 8 o'clock the following morning. Another thing to kind of consider in this to try to enhance communication could be the idea of the introduction of geographic rounding or minimizing the attending physician, the medical attending physicians that are responsible for a particular unit. So as opposed to, especially if we're using our Baptist Health affiliated medical group, as opposed to having 4 or 5 different medical attendings that are rounding in specific patient care units. If we drop that down to 1 or 2, then that enhances communication between the nurses and communication and availability to patients, as well as the consultants are only having to reach out to 1 or 2 physicians to give updated results or updates in progress. So ultimately for this, although there is a certain cost that may be associated with more related to the flexible scheduling, really what we're looking more is more for a kind of a shift or a change in the hospital culture, really with a focus on communication, where we're trying to enhance communication between the healthcare clinicians and to the patients in a more timely manner, and really prioritizing that these tasks end up being performed in a more efficient kind of manner to kind of see how they end up impacting care. So from this, out of the options that have been presented, we're actually looking at that last option of improved coordination of patient throughput. And again, this is based on the idea of enhanced communication among all parties of the healthcare team, and patients, really trying to stay up to date on pending tests, exams, and consultations, so they're being performed in an efficient and timely manner. Someone needs to assume ownership of this task list, so it's occurring in a rapid kind of fashion. Often it will require multiple departments to be involved and be flexible in it. So from our option, I'm now going to throw it back to Chase to bring us home.
All right, so we do hope that the information that we have provided through this presentation has been helpful. We do believe that West Kendall Baptist Health is poised to be successful regardless of which option they choose to go with, and that West Kendall Baptist Health must look at new ways to deliver care with a focus on optimizing outcomes, regardless of which option they would prefer to go with. And with that, we hope everybody has a great rest of their evening, and thank you for listening.
Thank you.